10 years ago, if a 40-year-old walked into my office asking for a facelift, most surgeons would have been polite and shown that patient to the door. Today, patients between 35 and 55 make up more than a third of all facelifts in America, and probably more than 60% or 70% of patients in my practice. That happened pretty quickly. So the question everyone's arguing about right now, is a facelift at 40 brilliant, or is it a huge mistake? I'm a board certified plastic surgeon in Newport Beach, and facelifts are the core of my practice. And my answer is gonna annoy both sides of this debate. So stay with me, because at the end, I'll tell you the one question that actually determines whether you're a candidate, and it has nothing to do with your age. First, let's talk about why this trend exploded, because it's not random. Three forces, as I see it, collided. Force one, filler fatigue. An entire generation spent 10 or 15 years getting injected, and many of them are now looking in the mirror at faces that are wider, heavier, and puffier than when they started. Smallish looking eyes, a boxy lower face, and contours that got blurred instead of restored. They're done chasing volume with a syringe, and they're asking what actually works. Force two, as I see it, the GLP-1 effect. Millions of people lost dramatic weight on these medications, and their faces deflated with the rest of them. A 42-year-old who lost 60 pounds can have the facial laxity of someone 15 years older, especially in the neck. Their driver's license says one age, their jawline says another. And force three, transparency. Celebrities used to deny everything. Now they announce their facelifts like album drops. When the stigma died, the waiting room got younger, at least in my practice. So let me steelman the brilliant side, because there are real arguments here. Argument one, better tissue, better result. I say this all the time. A 40-year-old has better skin elasticity, better collagen, better healing capacity than someone 30 years older. When I reposition the deep tissues in a younger patient, the skin tends to redrape beautifully. The result's often more refined than what I can achieve in a 70-year-old with the same technique. And argument two, subtlety. When you lift a face that has fallen 2 centimeters instead of 5, nobody needs to know or can easily tell that you had surgery. You just look like the best rested version of yourself. Younger patients don't get the "who did your facelift" comments. They get the "did you change your hair" type comments. And argument three, the math on longevity. A well-executed deep plane facelift doesn't stop the clock, but it sets it back permanently. You will always look younger than you would have without a facelift in the past. So longer-term data on facelift patients bears this out over decades. So the earlier you reset, the longer you enjoy the delta. And argument four, the one nobody says out loud, one facelift at 42 may replace 15 years of filler, threads, and energy devices that cost more cumulatively, and in many cases, can even distort your face along the way and make a facelift harder to perform. Now, I gotta argue the other side, because this is where I see people getting hurt. Problem one, a facelift treats laxity and descent. It doesn't treat being 40. If your tissues haven't meaningfully descended, there's really nothing to lift. Some surgeons will operate anyway, and that's not prevention. That's revenue. Problem two, the preventative framing is mostly marketing. You cannot pre-lift a face the way you prepay a mortgage. You can only correct what has already changed. If a surgeon tells a 35-year-old with great anatomy that surgery now will prevent aging later, ask them to explain the mechanism. Watch them struggle. Problem three, every facelift is also a commitment to the revision landscape. Do it at 40 and you may want another at 60. That's fine if you understand it going in. It's a problem if you were sold one and done. Problem four, trend pressure is not an indication. I've had consultations where the honest answer was, you don't need this, come back in 5 years, and here's what we can do in the meantime. I think I had 2 today. If your surgeon has never told anyone no, you're not in a consultation, you're in a sales funnel. So between that point and counterpoint, here's where I land. And it's really neither team. Age is the wrong variable, anatomy is the right one. I've operated on patients in their 30s who were outstanding candidates, who had real jowling, real deep tissue descent, and often after massive weight loss or years of overfilling. And I've turned away patients in their 50s who just don't need surgery yet. The one question that matters is this: has your deep tissue actually descended, and is that descent what's bothering you? If yes, a facelift is the honest answer and the correct operation, whatever your age. If no, then the honest answer might be volume restoration done correctly, subtly, some skin quality work, or simply patience. And one more thing about the who's giving you advice on this thing. A lot of the loudest voices on this trend are excellent surgeons, but when you're researching, understand the training behind the title and ask how the surgeon evaluates candidacy and ask what percentage of their consultations they decline. That last number will tell you something. So, facelift at 40. Brilliant for the right anatomy, a mistake as a birthday tradition. If you're in that 38 to 50-ish window and wondering which team you're on, drop your question in the comments. I do read them, and the best ones actually become videos. If you found this helpful, subscribe. I'm Dr. Jonathan Zelken, Newport Beach plastic surgeon. See you in the next one.